Why men need to stop drinking coffee. Did you know that your daily cup of joe might be putting your prostate health at risk? As men, we often overlook the importance of this vital gland until it's too late by assuming that its enlargement with age is simply a normal part of life. However, the reality is far more concerning, with an enlarged prostate posing serious consequences, from urinary issues to infertility problems. Prostate enlargement can occur in your 20s, 40s, and 60s, but the risk increases significantly after the age of 80, with a 90% chance of developing an enlarged prostate, also known as benign prostatic hyperplasia, or BPH. This makes maintaining a healthy prostate super important to prevent BPH. As a key component of the male reproductive system, a healthy prostate facilitates smooth urine flow, resulting in quick and painless bathroom visits. However, an enlarged prostate due to BPH can compress the urethra, leading to challenges with urination, discomfort, and pain. In some cases, male infertility may be attributed to an enlarged prostate. This occurs when the prostate and the surrounding bladder muscle obstruct the urethra's passage to the bladder, hindering semen from entering the bladder. Similarly, an enlarged prostate can affect your sexual life and overall satisfaction by causing discomfort after ejaculation, reducing pleasure derived from sex. This discomfort might manifest as a burning sensation during or immediately after ejaculation. And drinking coffee can worsen the situation, as it may irritate the organs near the prostate. That's why in this video, we'll be revealing why men need to stop drinking coffee. From the effects of caffeine on prostate enlargement to the risks associated with excessive coffee intake, we'll reveal why men need to reassess their coffee habits for the sake of their prostate health. So stay tuned until the end as we expose the hidden risks in your daily caffeine habit. Explore if prostate enlargement can lead to complications like prostate cancer, and reveal important strategies to help protect your prostate health. These insights we're about to share will empower you to make informed choices for a healthier and happier future. Your prostate gland is a walnut-sized gland found below the bladder and in front of the rectum. It's responsible for producing the fluid that makes up semen, which helps to nourish and protect sperm cells during ejaculation. This important gland is also surrounded by a layer of muscle that aids in pushing out semen during ejaculation. Additionally, the prostate gland contributes to urinary function by regulating urine flow, thereby preventing loss of bladder control and ensuring proper urination. However, factors like excess body weight, dietary choices, and age-related hormonal shifts can lead to the development of benign prostatic hyperplasia in men. This condition occurs when the prostate gland becomes larger, leading to various symptoms and complications. The enlargement happens because there are more cells in the prostate. As it grows, it puts pressure on the urethra, affecting urine flow. This can cause issues such as trouble urinating, a weak stream of urine, or dribbling after urination. That's why maintaining the health of your prostate gland to prevent BPH is so important, as it ensures smooth urine flow, making bathroom trips quick and painless. When the prostate enlarges due to BPH, it can compress the urethra, resulting in urination difficulties and discomfort. An enlarged prostate can also lead to severe complications like bladder stones, urinary tract infections, and kidney damage. Therefore, prioritizing your prostate health is essential for reducing these risks and maintaining overall well-being. In some cases, BPH may even cause the bladder to become so weak that it can no longer empty properly, leading to urinary retention. Perhaps the most concerning part of it all is that an enlarged prostate can either reduce or completely reduce the sexual drive in men, negatively affecting their sex lives. A healthy prostate plays a big role in maintaining a fulfilling, intimate relationship with your partner. However, an unhealthy prostate can affect sexual health by triggering issues like erectile dysfunction or painful ejaculation. If you don't have an enlarged prostate, you're safe, but you still need to watch this video until the end to find out how to prevent one in the future. But if you already suffer from an enlarged prostate and still drink coffee, then I'm afraid you're in a whole lot of trouble. Drinking coffee may be a source of irritation for men with an enlarged prostate. Many urologists suggest that the caffeine and acidic properties found in coffee can worsen BPH symptoms. Therefore, reducing your coffee intake could potentially alleviate symptoms and enhance overall quality of life. In certain instances, cutting out coffee entirely might be necessary to experience significant improvement. Caffeine, which is mostly present in coffee, acts as a diuretic, meaning it can increase urinary urgency and frequency, especially in those with BPH. The combination of an enlarged prostate and caffeine consumption can equally be a disaster, waiting to happen for those who have an overactive bladder, or OAB. This is because OAB already causes symptoms like urinary frequency, urgency, and leakage, and caffeine can worsen these symptoms. The increased urination resulting from caffeine intake can put additional strain on an enlarged prostate, as the bladder works harder to eliminate the excess urine. This can irritate and exert pressure on the prostate, leading to discomfort, pain, and challenges with urination. Caffeine can equally increase urine acidity, potentially irritating the lining of the bladder and urethra and intensifying discomfort and pain when you pee. In fact, coffee consumption can heighten bladder sensations and prompt tighter contractions of the muscles at the bladder's neck, where it connects to the urethra. These impacts can worsen symptoms of an enlarged prostate, including pain and difficulty urinating. Occasionally, you may struggle to completely empty your bladder after drinking coffee, experiencing sensations of fullness or urinary retention. Now, this brings us to the question of knowing how much coffee is safe for men to drink. First, the amount of coffee considered safe to drink for people with an enlarged prostate varies from person to person. Generally, it's recommended to limit your coffee intake to no more than 1 to 2 8-ounce cups per day. This amount will generally not cause an increase in symptoms. So for those with an enlarged prostate, drinking half of this daily recommended limit can reduce the symptoms of an enlarged prostate. However, it's important to speak with your doctor to determine the right amount of coffee for you, as everyone is different. Too much coffee can lead to dehydration and overstimulation of the bladder muscles, which can cause severe symptoms. To be on the safer side, it's best to stop taking caffeinated drinks and any drinks that may trigger the urge to urinate. These include coffee, energy drinks, soda, and alcohol. You may not realize it, but certain everyday items we often overlook contain significant amounts of caffeine. For instance, green tea contains a moderate amount of caffeine, approximately 30 to 40 milligrams per 8-ounce cup. Dark chocolate in particular contains caffeine, with about 15 to 30 milligrams in a 1-ounce serving. Additionally, certain sodas like cola can contain around 25 to 40 milligrams of caffeine per 8-ounce serving. Even some medications like Excedrin and Midol contain caffeine. Certain supplements like green coffee bean extract also have caffeine. But if you can't afford to give up your coffee drinking ritual, switching to decaf coffee or non-caffeinated herbal tea is a great option. These beverages don't contain high caffeine, so they won't cause the same symptoms as regular coffee. They also offer the same health benefits as regular coffee, such as antioxidants and polyphenols. And with so many flavors of herbal tea on the market, it's easy to find something to suit every taste. Therefore, being aware of the caffeine content in the foods and beverages you consume can significantly help in managing enlarged prostate symptoms. Another useful method to track your caffeine intake is by reading the nutrition labels of the products you buy. Many labels provide information about the caffeine content, facilitating easier monitoring and management of your intake. In addition to cutting back on coffee consumption, there are other lifestyle adjustments you can make to reduce enlarged prostate symptoms. This includes refraining from consuming liquids a few hours before bedtime and before leaving the house, as this can help minimize the need to urinate. It's equally important to limit alcohol intake, as these substances can irritate the bladder and heighten the urge to pee. Opting for a low-fat diet can also be beneficial, as fat has the potential to irritate the bladder. Consuming a diverse array of vegetables, whole grain, lean protein, and incorporating a few servings of fruit daily, especially citrus fruits, can further aid in symptom reduction. Regular exercise has also been shown to be beneficial in reducing enlarged prostate symptoms. When you exercise, the amount of urine retained in the bladder after urination reduces, thereby decreasing the frequency of peeing. In fact, regular exercise helps in stress reduction, which can contribute to decreasing enlarged prostate symptoms. Effective exercises for this purpose include walking, jogging, swimming, and yoga. It's advisable to aim for 30 minutes of exercise daily, at least 5 days a week, to promote overall health and reduce the symptoms of enlarged prostate. Don't also forget to drink enough water daily, as staying hydrated with water is essential for energy and alertness. It can equally help to minimize cravings for caffeine. So, aim for 8 to 10 glasses of water per day. And if you're wondering whether enlarged prostate and prostate cancer are the same thing, well, they're not. Although both conditions involve the prostate gland, they are very different. BPH is non-cancerous and doesn't heighten your risk of developing prostate cancer. Nonetheless, it's essential to consult a doctor if you're experiencing symptoms of an enlarged prostate. This is because some symptoms of BPH can overlap with those of prostate cancer. Regular checkups with a doctor are important for the early detection of BPH, because some symptoms of BPH can mimic those of other conditions, including prostate cancer. Early detection is also vital for effective BPH treatment. However, not all instances of an enlarged prostate necessitate treatment. If the prostate isn't putting pressure on the urethra and bladder, symptoms may be mild or absent. In such instances, monitoring the condition through regular checkups and maintaining a healthy lifestyle may be all that is needed. Now tell us, what other drinks do you know are responsible for worsening enlarged prostate? Share your thoughts in the comments below. Apart from your prostate health, did you know that there are some things that can kill your testosterone as a man? Click on the video showing on your screen right now to discover these dangerous testosterone killers and how to avoid them. See you there.